Dr. Lisa Chong, your TMJ and tongue tie specialist. Today I'll be talking about misdiagnosis of toothache. A lot of you will complain about toothache and say, Doc, I've got a toothache. And the first thing the dentist will do is to drill through the crown of the tooth and give you a root canal treatment. Now, a week later, the root canal treatment is completed. Doc, I still have the same problem. The pain is still there. Why is it still there? That's because the first problem of diagnosis is not on the tooth pulp that is the problem. It's the muscular problem which you have on this region, the TMJ problem. So misdiagnosis is quite common if you actually do not do the test properly. The first thing I would ask a person questions is that, can you tell me when you have this problem? When you're chewing your food, when you wake up first thing in the morning? So what happened is important, because sometimes the patient would have a cracked tooth already. And the cracked tooth sometimes is not diagnosed until it reaches the nerve. And sometimes you do need a root canal treatment. But before that happens, you need to diagnose whether it's a muscular problem or not. And to test whether it's a muscular problem, what I do very simply is to use my finger and palpate around the region and actually say, how do you feel? Do you actually feel worse or better when I do that? If the patient say, oh, this massage around the area actually makes me feel better. So by massaging the pterygoid muscles in that region, the patient feels better. That indicates there is some muscle activity that's making the patient feel better. The second thing I'll use local anesthetic. I'll inject into the tooth that they are complaining about, just one drop of injection, and I say, is the pain still present? Now, putting one drop of anesthetic in that region can indicate, number one, if the tooth has a problem, it's a tooth nerve problem. The patient will say that the pain has diminished. Okay? If the pain persists and they say, oh, the pain is radiating around this whole region, it's non-specific, I can still feel it around here. Most likely, the area is TMJ related. They say, oh, it's radiating here now. So diagnosis is so important. I encourage everyone, number one, to do your basic analysis, which is like, do your cold test, do your pulp test, do your local anesthetic test, and ensure that this is not a pulpal problem, but actually a TMJ related problem. So, and next thing is, it could be a combination of problems where the tooth is cracked from teeth grinding, and then you end up needing to crown the tooth, which is crowning the tooth because you need to prevent the crack from propagating into the whole part of the tooth. And maybe that's what you need as well. So do all these tests as related, and I hope that you get the right diagnosis. Thank you very much for listening today, and I look forward to seeing you next time. Thank you.